Hi Sagar,
Hi, sir. How are you?
I'm doing good. How are you doing for today?
Yeah, I'm doing good.
Okay, so are you excited for the interview of business analyst level one?
Yes, I'm very excited to prove myself.
All right, so let's start our interview with your introduction. Could you please introduce yourself?
Sir, my name is Sagar. I have completed my graduation in the year 2021 under University of Mysore in the BSc Honors Agriculture. I have 2 years of business analyst experience where I worked in a healthcare domain. So, my roles and responsibilities were understanding the business problems, gathering the requirement, analyzing the requirement, and documenting the process like PRD, FRD, user stories, process flows, and also the stakeholder management as well. Also, I have a hands-on experience on JIRA, MSVCO, and also a Confluence balsamic tools as well.
All right, so you said that you hold 2 years of experience in healthcare domain, right?
Yeah, yes, sir.
Yeah, could you please differentiate what is Medicare and Medicaid?
So Medicare, it is a generally government health insurance where it generally takes care of people whose age is 65 plus and disabled people. When it comes to Medicaid, it is about government health insurance only, but it is about low income people.
Okay, okay, what is the full form of RCM?
It is a revenue cycle management.
Okay, can you please tell me the steps, high level, the phases of RCM?
So it stands for RCM. It has several steps pre-authorization, eligibility verification and benefits, then claim submission, payment posting, denial management, AR follow-up, and the reporting. In pre-authorization, where the patient will be giving his insurance card and be verifying about whether he is eligible or not. In eligibility benefits and verification. Here, the patient will be knowing of what all the insurance schemes he might be eligible and what are the benefits he might be getting. In the claim submission, here the hospital team will be sending the payment bills to the insurance companies. Then it is about payment posting. Here the insurance company reviews and will be fulfilling the payment bills. Then denial management. Sometimes it may be the incorrect details or out of coverage services. In that situation, the payment insurance companies denies the payment. Then AR follow-up. These are the specific internal hospital team only where they will be following up the insurance claims to claim the pending payments and all. And reporting here, the reporting it is done by the hospital team only, like how many claims are done, what is the amount, and other related things to this insurance.
Okay, very good. What is the difference between CPT codes and ICD?
CPT codes, these are the codes generally for the procedure,
Okay,
whereas ICD codes, these are the codes for the diagnosis, like any hypertension and all.
okay, okay. I see that you have mentioned Curatech is your application that you have worked. Can you please give an overview of your project that you worked in the current company?
Yes, sir. Curatech is our web application where patients in the USA can search for doctors, see doctor location, book appointments, and book telehealth services as well. He can able to patients can be able to see the past prescriptions, upcoming appointments, schedule the appointment as well. He can also be update insurance information here. Yeah, and the main users of this Curatech application are admin, provider, and patients.
Okay, so till now, like how many stakeholders you have worked for this project? Can I know the names of the stakeholders?
Uh, uh, yeah, I have worked with multiple stakeholders involved here. Like some stakeholders were related to the patient portal admin, like they are coming under HR department,
Okay,
and many other.
all right. Okay. Uh, uh, I see that your role as a business analyst primarily includes requirement gathering, right?
Yes,
So can you tell me like what is the procedure? How do you gather the requirements? Can you define the steps?
yes, sir. So first I'll be understanding the problem from the or the business problem from the I'll be gathering the notes from the PO or the manager. Then I'll be analyzing it. Later I'll be identifying the stakeholders. After identifying the stakeholders, I'll be trying to book an appointment, like a schedule the call with him uh, based on his availability. Meanwhile, I'll be preparing the questionnaires and any questions that I need to ask during the call to make it easier and avoid confusion in the call. Then I'll be applying elicitation techniques during this requirement gathering in that call to gather the requirement effectively. Later, I'll be analyzing the requirement. I'll be breaking the requirement into functional requirement and non-functional requirements. Then I'll be reviewing them in front of the stakeholder only. Then I'll be getting the sign off from him. Later, I'll be writing user stories, acceptance rate, and will be updating in JIRA.
Okay, very well. So can I know what type of elicitation techniques you usually apply?
So there are many elicitation techniques, but mostly I'll be applying interviews as 90%, as it is mostly like a one-on-one call. Then I'll be applying document analysis and prototyping as well, where stakeholders were unclear.
All right, okay. Okay, so what is user story?
So user story, it is a piece of requirement written in the user point of view.
Okay, what is the format for that?
Now, so there is a specific format like as a I want, so that where as a means it is will be writing on whose perspective, like about the user will be writing. I want means what is the function we are doing that a user is doing. So that means what is the benefit, what is the benefit the user is getting by performing the function.
So you mentioned in your CV that you also create user stories as well, right, in the work environment?
Yes, yes,
Yeah,
sir.
could you please quickly share your screen?
Just
An open Word document. So I'll be providing you the requirement. So first of all, understand, okay? Then could you please create a user story for that? Okay. So please understand, I will be only, since you worked in healthcare domain, I'll be giving requirement on healthcare. So the requirement is, uh, provider want a breakdown of patient, which includes details, patient name, location, okay, and treatment details of patient and the
patient name, location,
uh, treatment details and insurance insurance status. Okay, so insurance status, and also uh, the provider has to have a donut chart which represents the count of patients bookings. Okay. Yeah, this was the requirement. Could you please break into the user story and acceptance criteria?
a minute, I'll go through and
Yeah, yeah, sure.
writing set.
So actually, can you please specify in the provider wants to view? Can you please write it down? Actually, provider wants to view a patient's, I told you, right? Patient's details breakdown, something.
Sir, you want me to write into one or can I break into two?
You can write it into one. So the requirement is provider has to view the details of patient. Okay. And also he also need to have a donor chart. That's it in simple. Yeah. Once you're done, you can let me know the user story.
Yeah, user story it is done, sir.
Okay, fine. Yeah, thank you. So my next question, you can stop sharing your screen. So my next question was, could you please list out the number of Scrum ceremonies in the Agile?
So there are mainly four Scrum ceremonies in Agile, like sprint planning, sprint review, sprint retrospective, and daily stand-up. In sprint planning, it is about planning what we have to do in the upcoming sprint under a PO, I mean product owner guidance. In the sprint review, here developers will be demonstrating what they have developed to the stakeholder. In sprint retrospective, it is at the end of the sprint where teams will be discussing about what went wrong in the sprint, what are the things need to be improved, and expressing the gratitude as well. Daily stand-up call, it is a 15 minutes daily call of what needs to be done in the day, and will be identifying any blockers and all.
Okay. What is your role in UAT testing?
So my role in UAT testing is understanding the business rule and expected outcomes, creating the UAT test scenarios and test cases based on the requirement, and it's like coordinating the testing. Coordinating testing, tracking the defects, and make sure fixes are being applied, and also making the outcome meets the expected business goals, and also getting the UAT sign off from the stakeholders.
Okay. What is the difference between BRD and FRD?
BRT means it is a business requirement documentation, whereas FRD means functional requirement documentation. In BRD, it is a high-level documentation of the project in the stakeholder point of view, whereas FRD, it generally implies what the system does based on the user interaction. It is mainly about based on the BRD only, this FRD is created.
Okay. As a BA, can you tell me how do you prioritize the requirements?
So, sir, I prioritize as a business analyst. I prioritize the requirement using Masco technique, where M stands for must have, C stands for could have, S stands for could should have, and W stands for won't have. In my healthcare project, I have applied this technique where document upload fix was a must have feature. Then it was about minor, performance improvement requirement was there where it was should have, and minor UI improvement requirement was there. It was could have, and uh, low priority requirements were there, which were considered as a won't have for the current release.
Okay. Very good. So also tell me, we often get change request in the Agile. So can you tell me as a BA, how do you handle change request?
So in my Tech project, there was a time where a stakeholder came to replace the search bar with a radio button for the payer selection to enable faster and easier selection. As a business analyst, I handled it from end to end. First, I gathered the requirement from the stakeholder to understand the business need of faster selection. Then I verified the scope against our in-scope documents uh, to check to ensure this change request is within project boundary.
Okay.
Then I did a
Yes,
sir.
yes. Continue, continue.
Yeah. Then I did impact analysis of this, on the timeline, resource, and system and risk. Where in I identified that I found that additional 8 hours of time is required to implement the change, and we need one additional developer to complete this change. And also, if we do not implement this feature properly, there will be a misalignment in the UI, which affects the overall usability. And while coming to risk, if we do not implement this feature, the users may get frustrated as they may not be able to select the pair properly, which affects the user satisfaction and adoption. Then I collaborated with the uh, developers, testers, and operation team to clarify the change and to show the impact and plan the implementation. I also determined about the urgency and the dependency as well, and communicated this to priority and communicated this to stakeholders. Then I documented the change request about capturing all the requirements, the impact, approvals, and also the potential impact of this feature, and shared it for future reference.
Very good. Okay. So my next question was, can you tell me what is gap analysis? Did you apply any gap analysis in your previous project?
Yes, sir. I have applied it. Gap analysis is nothing but a compare. It is a comparison between the current state of the project with the future desired state. So, in my Curatech project, um, we implemented a feature called telehealth services, where patient can book virtual appointments after the go live. The patients patients I mean users reported that the page is not loading, or it is loading very slow. Then I gathered the feedback from the users and connected with the support team to understand the main pain points and to find the root cause. I also go through the existing workflow. In my finding, I found that there is a no monitoring or alert mechanism for the page delays loading. Then I proposed notifying the admin team if the page or app is not loading within 2 seconds, and logging the reason in the name of narration. Then after implementation, the problem is resolved proactively, and also complaints got reduced, and the overall visibility is very better compared to before. In the current state, it was telehealth feature was implemented, no monitoring for the page delays loading, and it was there. Whereas in future desired, in the desired state where coming feature was implemented and the monitoring mechanism was there, and also there was a triggering to admin if the page loading is taking more than 2 seconds. By this way, we can do gap analysis comparing the current and future desired state of the
Oh,
project.
okay, very good. Okay, what do you know about KPI and how do you monitor and track the KPIs as a business analyst?
So KPI, sir, KPI stands for key performance indicator, which is used to track the how the business is going, how far we are to measure the success of the business in simple terms. So in my Curatech project, where there was a situation where the providers registration were very slow, like only 45% were getting approved with the service level agreement, which is causing frustration and delays. Then I connected with the admin team and found out that there is a no auto approval mechanism for this provider approval. I suggested a auto approving functionality based on the provider's NPI number. Then I monitor these KPIs. I also tracked the results by pulling the reports and taking the feedback. I found that 60% of the provider's registration is done automatically, and also eliminating the wait times of the providers, and also saving the admin work like 10 hours per week. In this way, I tracked the KPIs. I presented it to the stakeholders, like how it is improved and impacting the business.
All right, okay. Okay, so often we see that many different stakeholders will be conflicting each other. So could you tell me, did you handle any time in your project the stakeholders conflict? So if yes, can you define the steps? How do you handle?
Yes, yes, sir. Actually, in my previous project, there was a time where two stakeholders were conflicting. Building team and the compliance team, they were conflicting with each other for pushing their requirement into the next release. Uh, Actually, billing team wants the patient daily report update, whereas the compliance team want only weekly reports. Then I scheduled a joint call with them for both of them, where we three were there, and I noted their concern and I proposed a compromise where um, daily reporting will be the daily data collection with weekly reporting is done. Both were agreed with it. Hence, the system delivered value in the each sprint while meeting the regulatory compliance. In this way, I handle the stakeholder conflict in my previous project.
Okay. What exactly you will be doing during post-deployment support as a part of post-deployment support as a BA? What is your role?
Yeah. In the post deployment support, first I'll be identifying the go live items with the help of, like what is it is releasing with the help of QA and developers. Then I'll be doing a very basic smoke testing by taking the data from the developers only. Also, I'll be creating the release notes for the stakeholders and support team. I'll be creating and maintaining and updating the user manuals for the end users. Yeah.
Okay. Okay. So my next question was like, let's assume that you often get the requirement from the stakeholder. If the stakeholder was unclear with the requirement as a BA, what exactly you will be applying and ensure that you gather the proper requirements?
So there was a situation I have gone through this. So in our Curatech project, there were some stakeholders who were unclear about the patient portal. So I connected with the stakeholders. Then I created some low fidelity wireframes and mockups. I presented it to them. With the help of these visuals, the stakeholders were able to understand the requirement clearly, and by taking their feedback, I updated the existing user stories and acceptance criteria in the JIRA, so that development team is having the clear requirements before starting the development.
All right. Okay. My next question was, can you tell me a situation where you improve the business process that was brought the value to the project? Is there any improvement that you made?
Yes, sir. I have given that input. Uh, like there was a situation where CMS 1500 claims were getting denied continuously, more repeatedly. So I connected with the billing team and analyzed the rejected claim data to understand the root cause. Then I identified that there was a no validation check for the authorization. Then I propose the system authorization rule to flag the missing or inauthorization numbers. Like it will be giving the notification like that. Then I also worked with the development team closely to implement it and making sure that the PHI is a state safe, secure, and a HIPAA compliance. Then I also, after implementation, I also cross-check the functionality with QA as well and make sure everything is working as per expected. In this way, I gave this input, which helped in reducing the claim rejections by 30% and also improved the reimbursement cycle within 10 days.
Okay, very good. So, okay. Do you know SQL?
No, 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 sir, actually, but if you give
Okay.
me a chance, I'll be going through after the call.
Okay. What about the visuals? You will be creating visuals as well as a BA.
Yes, sir.
Okay. What do you know about Power BI? I mean, what exactly you will be doing in Power BI?
So in Power BI, I'll be creating dashboards, taking the data from uh, Excel sheets or SQLs,
Okay.
where we can be creating weekly reports whenever the stakeholder require anything or something like.
Okay. Okay. So, okay. Which tools as a BA you will be using in the work environment?
Yeah. So mainly as a BA, I'll be using JIRA for project management, Confluence for documentation and sharing the documents, and also MSVCO for the process flows, Excel for data tracking and RTM, and also Balsamic for creating wireframes.
Okay. Okay. How do you convert the requirement into functional and non-functional? Can you tell me?
So we can simply it will be like when coming to functional requirements. So we can simply say that what a system does or what are the user does, we can conclude them as a functional requirement. Like coming to non-functional requirement, we can take it like how system is able to perform. For example, we'll be taking from our previous project only. We implemented telehealth feature, right? So, patient will be entering the details, booking the appointments, clicking on search, and system will be displaying the results based on patient inputs. We can consider them as functional requirements, whereas how much time system is taking to load the page, and also how much time, how many users a system can handle at a time, what is the maintainability, scalability, availability of the system. Well, like all this we can consider as non-functional requirements.
Okay. So can you tell me like if the IT team developer has feeling complexity with the requirement, how do you ensure that they are understanding the requirement properly? What measures you will take?
Uh, like I'll be conducting a grooming session. I'll be trying to simplify the requirement, and I'll be trying to explain them again by showing them visually, creating the process flows and all.
Okay. What process flows you create?
Like streamline diagrams.
Okay. 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 Fine. And also, can you tell me like what is the difference between product backlog and sprint backlog?
So yeah, product backlog. Product backlog is where I mean it is will be the collection of requirement which is owned by PO, whereas sprint backlog, which are actually working in the current sprint, which is owned by the developer team.
Okay. Fine. So my last question was like, if the domain is very new for you, how do you ensure that you are learning it so that you can gather the requirements? What measures you will take?
So yes, sir. So if the domain is completely new for me, I'll be starting my basic domain research using through starting the basic domain research through official websites, product demos, or by asking internal SMEs. I'll be asking the stakeholders high level questions in order to understand the business goals and domain related terminology. Then I'll be requesting any existing documents, even if it is a small workflow, old screenshots or process flows. Also, I'll be observing the existing workflow processes through the shadowing the users, and yeah, shadowing the users. Also, I'll be trying to document my understanding and validating this with the SMS to ensure correctness. Yeah, like this, I'll try to cope up with a new domain.
All right. Yeah, that's it from my end. Very good. The interview was went. So that's it from my end.
Thank you,
So do
sir.
you have any questions for me?
Yes, sir. I have one small question. If everything goes well with the interview, may I know in which domain I'll be working?
Okay, you will be working with the e-commerce domain. So our company was having multiple domains. We have multiple clients, but we are looking for someone who can work upon the. We are going to start a new project with respect to e-commerce domain. So you'll be working with that domain.
Okay, sir. That's it.
Okay, thank you, thank you. So HR will get back to you with the feedback. Okay, thank you for your time.
Thank you, sir.